Thank you very much. Alex Light from Imperial College London. So I'll be presenting on the IP14 FOCUS study, and this is in the realm of focal therapy. So FOCUS is funded by the UK NIHR. So in-field recurrence, so recurrence within the treated area after focal therapy affects approximately 1 in 5 patients within 5 years, and certainly is one of the limitations currently of focal therapy. One way this could be addressed is potentially using something called contrast-enhanced ultrasound during the operation. This assesses microvasculature, could be used therefore to detect residual tumour intraoperatively, and if identified, could allow for retreatment of that focus within the same operative session. The aim of FOCUS is it's an ideal phase 2A single-centre prospective study based at Imperial to evaluate the implementation and therapeutic value of contrast-enhanced ultrasound within a prospective multi-energy setting. So the intervention is such, so patients are put to sleep under anaesthetic for their focal therapy. They undergo an on-table pre-treatment contrast-enhanced ultrasound with the aim of visualising the tumour and the planned treatment zone. Focal therapy is then delivered as it would be done normally. Afterwards, with the patient still asleep, a second post-treatment scan is done on table with the aim of determining if any residual tumour is present. And if so, if identified, the surgeon is permitted to then deliver further ablation to that area if required and feasible. So this is an example of a patient who's undergone a right-sided HIFU, and you can see a very nicely, sharply delineated treatment zone there. And in contrast, the B mode on the left doesn't show any particular treatment effect. On the other end of the spectrum, this is a patient who, again, has undergone a right-sided HIFU, but you can see in the posterior margin of the treatment zone, there was an area that did enhance slightly earlier and slightly more strongly compared to the tissue around it, and this potentially could be a source of residual tumour. The primary outcome is so all patients will undergo a 12-month biopsy after treatment. The primary outcome is the presence of in-field grade group 2 to 5 cancer on that biopsy, and we've estimated we would need 118 patients to estimate that. Secondary outcomes include the proportion of patients who undergo further treatment, the additional operative time it would add, safety, PROMs, and we're also looking at the quality and the interpretation of our contrast ultrasounds by our surgeons as compared to that by an expert user to try and get a gauge on quality and learning curve. And then lastly, recruitment rate with views to potentially planning a bigger study later on. So in terms of progress, we've recruited 44 patients of the 118, so 37%. We anticipate this will be complete by the end of the year. And we've treated 20% of patients, and we anticipate to finish treatment approximately a year to today. And primary outcome, we anticipate the results will be available by the mid-2028. Thank you.